name is Dr. Akiva Daum, and I'm going to talk to you all about the emergency bag, which is located in that office under Ricky's desk. The emergency bag is here for emergencies. We hope to not need it, but we have it just in case. On this side, we have first and foremost a list of everything that should always be in the emergency bag. That's important because it needs to be checked on a regular basis. This has the personal protective equipment, including rebreather masks, gloves, masks, etc. On this side, we have medications that we would need only in an emergency, which include glucose if somebody's having low blood sugar, aspirin if somebody's having chest pain, an EpiPen if somebody's having an allergic reaction, that their throat is closing, and Narcan. Narcan is one of the newest additions to the emergency bag. Narcan is for opioid overdoses. If somebody is in a situation where they are not breathing, their lips are blue, their fingertips are blue, they're not responsive, and they have potentially come in contact with an opioid. This includes staff who could be searching through somebody's property and come in contact with an opioid. Narcan is the way to go. You open the box, take the spray out, and there's instructions right here, and all you do is stick it in one nostril and push the plunger down all the way. You then call 911 and continue doing CPR. In here, we have pads and gauze, we have an ambu bag to help people breathe, and a towel. That's the emergency bag, which again is located under Ricky's desk. It should be easily accessible and everybody should know where it is, and it will be checked once monthly to make sure that it has all of the equipment still in date. Anyone have any questions about the emergency bag or when to use Narcan? Yes? So the way you use Narcan is if they end up being in an overdose, which again, not responsive, not breathing, blue around the lips, blue around the nail beds, don't respond to their name, you open up the box and there's a nasal applicator that you just stick in their nose and push. And then you would resume doing chest compressions and CPR. And someone else would call 911 and let them know what's going on. Yes?
So would you spray before the CPR or after?
Whichever comes first. If somebody else is getting the bag, you would start CPR. If the bag is there, give Narcan, especially if you know that it's because they came in contact with an opioid. Other questions? Remember, opioids include oxycodone, fentanyl, heroin, morphine, and especially a lot of the new fentanyl derivatives is what we really get concerned about. And again, the emergency bag is for anyone who is having an emergency, be they staff, be they visitors, be they patients. Other questions? Yes?
Who will administer the EpiPen? Could it be medical or non-medical staff?
Preferably medical or nursing. If there's an emergency, medical and nursing should always be called. Let's say it's in the middle of the night on a Saturday night, nursing is still here. And obviously we want to make sure we notify everyone, but we would notify them after or as things are being taken care of. So of course the first and foremost thing is that we get the patient breathing again. As that's going on, someone else can call myself, one of the other medical practitioners, to let them know what's going on, but somebody should also be calling 911. The good news is we always have enough staff to be able to have people helping the individual, calling 911, calling the medical staff. But we want to make sure that first and foremost, we correct the emergency as best we can and lead to further corrections by calling 911. When in doubt, 911. Other questions? Wonderful. Thank you, everyone.